Hello everyone, my name is Shabitha Premachandran. My colleagues Yogita Chavda, Jennifer Francis-Merino, Batisani Matibo, Samantha McDougald, Sanaz Sabihi, and I will be presenting to you about cardiovascular disease. Throughout this presentation, we will be discussing how cardiovascular disease is consistent with the definition of chronic disease. We'll provide a descriptive epidemiology of cardiovascular disease. We'll describe the characteristics and symptoms. We will look into an aspect that makes cardiovascular disease a complex disease, and we'll describe a rehabilitation strategy that is commonly used to address the disease.
There are multiple definitions for complex chronic diseases, and it is very unlikely that there will be a consensus from the health community about what truly constitutes complex chronic conditions unanimously. However, the Ministry of Health and Long-Term Care have put forth a list that best describes what makes a condition chronic at this point. The definition is as follows. Chronic diseases are long-term diseases that progress slowly over time. They often advance in severity and can often be controlled but rarely cured. They may considerably hinder everyday physical and mental function, and they also reduce a person's abilities to perform activities of daily living. Cardiovascular disease is an umbrella term that includes diseases like coronary artery disease, atherosclerosis, heart attack, enlarged heart, and heart failure. A good example of a chronic cardiovascular disease is atherosclerosis. Atherosclerosis is a slow progressive disease that could start as early as childhood, but could progress into a person's mid-30s to late adult years. This disease causes the arteries to harden due to a buildup of fatty plaque that prevents proper arterial contraction, as well as adequate blood flow to the myocardium and/or to the periphery. If atherosclerosis is permitted to progress, it can cause coronary artery disease. CAD usually results in myocardial infarction, as it is the coronary arteries that directly supply the heart muscle with blood. Atherosclerosis clearly progresses in severity. There are certain things that can be done to control atherosclerosis. However, there is no cure. Control measures include quitting smoking if the patient is a smoker, reducing bad cholesterol, which is the LDLs, as well as controlling high blood pressure. Diet and exercise also can help control the progression of atherosclerosis. While atherosclerosis itself may not directly affect a person's physical and mental functioning, however, the complications it causes can. Atherosclerosis can cause angina. Stable angina is caused by the heart struggling to meet the oxygen needs of the body. For example, if a person with atherosclerosis and angina needs to walk up the stairs to reach their apartment, this will cause pain. The pain will occur as the heart is struggling due to an increased oxygen demand that simply cannot be supplied. This particular form of cardiovascular disease itself may not affect a person's abilities to perform activities of daily living, but if a heart attack occurs or the person is in heart failure due to the atherosclerosis progressing to a more serious cardiovascular disease, then certainly their ability to self-care would be significant.
Descriptive epidemiology looks at the people affected, the place, and the time. Cardiovascular diseases are the leading cause of death in the world. They account for 1/3 of all death worldwide. About 17.5 million people died from cardiovascular diseases in 2012, representing 31% of all global death. 7.4 million deaths are a result of coronary heart diseases, 6 million due to stroke. More than 3/4 of cardiovascular deaths are reported to be in low and middle income countries. There is increased morbidity and mortality in age group of 30 to 44 years. Fatal cases are common in men. Smoking and high triglyceride levels poses a higher risk in women than men. Oral contraceptives, hormone replacement therapy, and polycystic ovary syndrome are gender-specific risk factors. A person's cholesterol level is also affected by age, sex, heredity, and diet. There is an increased cardiovascular diseases in African American and South Asian populations. Stroke risk is high in African American, Chinese, and Japanese. Studies show that in the US and the other developed countries, there have been a reduction in the past years. However, in developing worlds, it is still increasing. Incredible progress has been made tackling cardiovascular diseases in Canada over the past 60 years, with death rates declining by more than 75%. Research studies show that by adopting healthy behaviors, You can delay the onset of heart diseases or stroke by as much as 14 years.
Symptoms of heart disease. Heart disease symptoms depend on the type of heart disease. Also, heart disease symptoms can be different in men and women. For example, in atherosclerotic disease, men are more likely to have chest pain, while women tend to feel shortness of breath, nausea, and extreme fatigue. Symptoms of heart disease in your blood vessels or atherosclerotic disease include chest pain or angina, shortness of breath, numbness, pain in the neck, jaw, throat, upper abdomen or back, and weakness or coldness in your legs or arms. Heart disease symptoms caused by abnormal heartbeats are fluttering in your chest, racing heartbeat or tachycardia, slow heartbeat or bradycardia, chest pain or discomfort, shortness of breath, lightheadedness, dizziness, and fainting or syncope. Heart disease by heart defects refer to defects you are born with and usually become evident soon after birth. Heart defect symptoms in children include blue skin color or cyanosis, swelling in the legs, abdomen, or areas around the eyes. Symptoms of the congenital heart defects in later childhood or adulthood are easily getting short of breath during exercise or activity, easily tiring during exercise or activity, swallowing in the hands, ankles, or feet. Later childhood defects are less serious and they are not immediately life-threatening. Cardiomyopathy is the thickening and stiffening of heart muscle with no symptoms in early stages. In worsened conditions, symptoms are breathlessness with exertion or at rest, swallowing of the legs, ankles, and feet, fatigue, irregular heartbeats that feel rapid, pounding or fluttering, dizziness, lightheadedness, and fainting. Three types of heart infections include pericarditis, that's infection of the tissue surrounding the heart, myocarditis, which affects the muscular middle layer of the walls of the heart, and endocarditis, that's infection of the inner membrane that separates the chambers and valves of the heart. Depending on each type of infection, symptoms are slightly different. In general, symptoms include fever, shortness of breath, weakness or fatigue, swallowing in your legs or abdomen, changes in your heart rhythm, dry or persistent cough, skin rashes, and unusual spots. Valvular heart disease means when valves of the heart damaged by a variety of conditions such as leading to narrowing or stenosis, leaking or regurgitation, and improper closing or prolapse. Symptoms of the valvular heart disease include fatigue, shortness of breath, irregular heartbeat, swollen feet or ankles, chest pain, fainting, or syncope.
Before I get into the details of how heart disease can be classified as a complex disease, let's look at the definition of what a complex disease is. There are many common diseases that exist that have the ability to be triggered by a combination of genetic, environmental, as well as lifestyle factors. These are the diseases that are referred to as complex diseases. Even though complex diseases are known to run in families, it can be difficult to determine an individual's risk or susceptibility of acquiring or developing the disease due to the fact that these complex diseases do not have clear-cut patterns of inheritance, unlike single gene disorders, which are disorders that are caused by defects in one particular gene and often have simple and predictable inheritance patterns. Also, because complex diseases are attributed to and caused by both genetic and environmental factors, these diseases have been proven to be difficult to treat. Other diseases that are classified as complex diseases include diabetes, epilepsy, hypertension, asthma, and schizophrenia. Now that we have established an understanding of the nature of complex diseases, let's discuss an aspect of how heart disease, or in other words, cardiovascular disease, can be complex. As we now know, heart disease can be caused by a number of genetic factors, which is one of the reasons that makes heart disease fall under the category of complex diseases. Let's focus on the particular aspect of these genetic factors that influence the onset of heart disease in respected individuals. Our genes have the unique ability to influence and control every single part of the cardiovascular system, from the strength of the blood vessels to the way the cells in the heart communicate.
A genetic variation, also known as a mutation in a single gene, can alter the risk of an individual developing heart disease. These mutations are passed from parents to children in the DNA of the eggs and sperm. As an example, a genetic variation can have the potential to change the way a particular protein works, leading to the body to process cholesterol differently, causing the increased likelihood of blocked arteries, which is one of the risk factors for heart disease. This mutation in the gene that regulates cholesterol levels in the body is known as the missense RS4238001 variant, which alters the type of protein made by the gene SCARB1, thereby affecting the body's cholesterol regulation. Another component of the genetic factors that can influence the risk of heart disease is a person's racial heritage. Recent studies have shown that nearly half of all African American adults have some form of heart disease, compared to 1/3 of white adults. It has been speculated that African Americans' higher susceptibility for diabetes, high blood pressure, and stroke could play a role. According to a recent report from the CDC, it has been shown that Hispanics were 25% less likely to die of heart disease than whites. Statistics have also indicated that about 1 in 3 Hispanics will suffer from high blood pressure, and nearly half of them will encounter high blood cholesterol. They are also more likely to suffer from diabetes as well as obesity. And lastly, with regards to Asian immigrants, heart disease rates vary widely. South Asians tend to have a higher onset of coronary heart disease. Immigrants from East Asian countries have lower rates of heart disease. Here are some environmental and lifestyle factors that also contribute to heart disease being classified as a complex disease. Some of the environmental factors include the amount of pollution in the air, as well as an individual's level of exposure to these pollutants. Some lifestyle factors include smoking, physical inactivity, poor diet, as well as excessive intake of alcohol.
Cardiac rehabilitation. According to the Heart and Stroke Foundation, cardiac rehabilitation, or also known as cardiac rehab, is a program of exercise education and counseling that is designed to help cardiac patients recover after a heart attack or other heart conditions such as acute coronary syndrome, or known as ACS, atherosclerosis, atrial fibrillation, heart block, pericarditis, and others. When a patient is in cardiac rehab, they have a team of professionals that are there to improve their physical and emotional health. Every program varies depending on the patient's needs and area of residence. The team of professionals may include a physician, exercise physiologist, nurse, occupational and physiotherapists, physical educator, dietitians, psychiatrists or psychologists, and a social worker. As mentioned, cardiac programs vary depending on the patient's needs and location, but also they include the general following. Medical assessments, which this evaluates the patient's physical abilities, limitations, and risk factors. Physical activity. This exercise is to improve the cardiovascular and muscular fitness. Lifestyle education, which are experts advise about diet and nutrition. And psychosocial support, which strategies for managing depression, anxiety, and returning to work. Here are a few of the cardiac rehabilitation programs listed in Ontario: Lakeridge Health Cardiac Prevention and Rehabilitation Program in Oshawa, Cardiac Rehab Program in Toronto, and another Toronto location, which is Central East Regional Cardiac Care Program. Here is a website that will provide all cardiac rehab programs across Canada.
Nutritional counseling is a cardiac rehabilitation strategy that helps patients understand the impact food can have on their health and helps individuals make healthier choices. By following a diet plan, it allows high-risk individuals to reduce the risk of developing cardiovascular disease and helps those with cardiovascular disease to slow down or partially reverse the narrowing of the heart's arteries, as well as prevent further complication. The study conducted by Ramon Estruc and his colleagues looked into the efficacy of Mediterranean diet among individuals who are considered to be high-risk patients of cardiovascular disease. The objective of the study is to determine whether a Mediterranean diet will reduce the risk of developing cardiovascular disease among high-risk individuals. In order to test to see whether a Mediterranean diet would reduce the risk for these individuals, the researchers conducted a multi-center randomized trial with a 6-year follow-up. Eligible participants were men ranging from the ages of 55 to 80 years and women from 60 to 80 years of age. These participants were at risk of developing cardiovascular disease but did not have cardiovascular disease. In order for these participants to take part in the research study, they must either be diagnosed with type 2 diabetes or at least 3 of the following major risk factors, such as smoking, hypertension, elevated low-density lipoprotein cholesterol levels, low high-density lipoprotein cholesterol levels, overweight or obesity, or a family history of premature coronary heart disease. As for the results, the participants were randomly assigned to one of 3 intervention groups through a 1:1:1 ratio. The 3 intervention groups were a Mediterranean diet with olive oil, a Mediterranean diet with nuts, and a controlled diet. Those that were assigned to the controlled diet group, they were advised to reduce the intake of dietary fats. This study included a total of 7,447 participants, and of the total participants, 50% of them were women. The study found that those who were assigned to the intervention group adhered to the diet, and no diet-related adverse effects were reported. The study found that the 2 intervention groups began increasing their intake of fish by 0.3 servings and legumes by 0.4 servings when compared to the control group. The intervention groups also increased their consumption of olive oil to 32 and 50 grams per day, and their nut consumption to 0.9 to 6 servings per day. In conclusion, the study found that a Mediterranean diet supplemented by olive oil or nut consumption resulted in an absolute risk reduction in 3 major cardiovascular events per 1,000 person years, with a relative risk reduction of 30% among individuals who were considered high-risk patients who were initially free of cardiovascular disease. While the control diet that consisted of low-fat diet approach resulted in no benefits in regards to a reduction in the risk of cardiovascular disease. This study is a valid study that was able to prove that a Mediterranean diet can reduce cardiovascular disease. The results of this study supports what the researchers had hypothesized, and the findings in this study was consistent with prior research that claimed that a Mediterranean diet reduces an individual's risk of developing cardiovascular disease. The study was also able to prove that there is an inverse association between Mediterranean diet and the incidence of stroke.